All right. Well, good morning, everyone. Good Friday morning. This is Lynn Schrader with KHI, and thanks for joining our update for the Patient Protection and Affordable Care Act. And it's up to the minute, up to what we know through today. So let me get going here with the slideshow. This will be recorded, by the way, and posted on our website for review later, as well as the slides. And all right, so let's start out with what we know is kind of in the news this week, and make sure you guys are up to date on this. So on Tuesday, the Department of Health and Human Services did approve what we're kind of referring to as our Medicaid expansion in Iowa, also known as the Iowa Health and Wellness Program. As you know, this was formerly also called Iowa Cares currently, and all the Iowa Cares folks are going to be moving into one of these Affordable Care Act plans on the marketplace. And so we had been waiting and waiting for this finally to get approved, and we anticipated that it would be. So it finally was approved. And initially they came back and said that they did not want us to tie premiums to these healthy initiatives that Governor Branstad had recommended. So just this morning, literally on my drive up to Fort Dodge this morning on the radio, it said that they do have agreement, that Governor Branstad accepted what the federal government approved, and it really did have to do with being able to charge premiums to some of those folks, really, that are low income and that maybe shouldn't have premiums charged to them, but they wanted to, Governor Branstad wanted to charge them premiums if they don't go get their annual exam and complete a health risk assessment. And the federal government said you can't do that. Well, how they've come to agreement is they'll probably bill them for that. They just can't collect it. How's that? So they'll bill it, and if somebody pays it, they do. But the incentive hopefully is there to fill out their annual assessment and get their physical exam. So anyway, reported this morning we have agreement, which is a great thing because we know there's a bunch of Iowans in that 101 to 138% of the federal poverty. Now, I also was with a gentleman yesterday from the Iowa Insurance Division, and I got clarification. A lot of times we see 133% of federal poverty. That was the old regulation with Iowa Cares. There was an extension of that up to 138% that we had asked approval for, and that was granted. So you'll see some slides will show the federal poverty level up to 133. I've updated a lot of ours to show all the way to 138. So again, the Iowa Health, the new Health and Wellness Program has been approved, and up to 138% of the federal poverty level. So those that are already registered for iCares, if you guys run into these folks, they're going to be automatically assigned to either Co-Opportunity or Coventry. And as we've learned from Coventry's training, they're not paying commissions on any of that business. Co-Opportunity has said they will pay commissions. Commissions are already worked into their sales. So if you work with somebody, you'll be compensated on a Co-Opportunity case. We also know that some folks have already gotten signed up, and what we're working on in this coalition that I'm a part of as a result of the Big I, NAHU, and NAIFA, we're talking with the insurance division about the need to be able to, after somebody enrolls, to assign an agent to that client, that many people are so confused right now. So Co-Opportunity has already stepped up and said, we'll help with that at a carrier level for them. They've said, we'll create some kind of a form that a client can sign saying, I meant to have Jane Smith be my agent, and she wasn't with me, or I didn't get her numbers plugged into the healthcare.gov website. So Co-Opportunity is already working on that, but we as a coalition are working to try to get that mandated for all carriers so that it gives the right to any client that chooses to work with an agent, although they may have gone direct through the website through all this confusion. So stay tuned and more information on that. But I think you guys, when we do the right things, I'm going to trust that we're going to be taken care of, because we know we're making sure that our voices are being heard. We have to take care of the clients. And I did have a meeting with the governor through our coalition a couple weeks ago, and it was so refreshing to hear the governor say that as it relates to health care reform, we have to look out for the needs of our Iowa citizens. And it was so neat to hear him say, he didn't say first that we need to watch the financial budget of the state of Iowa. He said we need to care for the citizens in Iowa. And so I just love that he has the same feel that we do about taking care of our clients first. And when we do the right things, then I believe with this coalition behind us, we will get this passed somehow, some way. So I'll keep you posted on that. But as I did say, Co-Opportunity is working on something so that if you did get a case enrolled through Co-Opportunity and your name didn't get on it, that they'll have a way that you can get a form to your client, have them sign it, and get you assigned to their case. And then Co-Opportunity will recognize you as the agent of record. So more to come on some of that stuff. Next, a couple of things on some updates on healthcare.gov. So as we now know, December 15th for a January 1 effective date on individual applications through the healthcare.gov website has been pushed out to December 23rd. So we've got a little bit more time to get folks into the healthcare.gov website for a January 1 effective date. Now, I realize that there's a lot of people that might be interested in trying to get in by January 1, but remember, if we miss that December 23rd cutoff, and of course we've got holidays and people travel and all kinds of crazy stuff, but remember then, obviously we're still in open enrollment, so as long as then, if the application doesn't get in until December 26th or 28th or whatever, then they'll simply be getting a February 1st effective date. So they'll miss out on having insurance then for the month of January or on getting rate relief. As you know, and we'll talk about HIP Iowa in just a little bit, there's some plans that are going away. Now, I did talk to a gal that had Assurance, and her plan wasn't being terminated until February 1st. So I guess I just want to say, always make sure you find out what your client has. And it might mean they pay a little bit more because maybe there's some savings. But again, it's just obviously we're all under the time crunch here where the site really wasn't working and we're still figuring things out. Go to the next bullet. We found out, and thanks to an agent, which will open the phone lines up here so we can do some sharing, but thanks to one of our agents who emailed me and said, hey, I did get all the way through, and I've realized that a Coventry application, they asked for the billing information, and that's all good and fine, but on Co-Opportunity, they're not asking for any billing information, and they're saying something like, you need to call us within 4 days so we can work out the billing arrangements. So thanks to you guys for giving information to us. I forwarded that on to Co-Opportunity, and of course they're working on it. I don't have any more details, but they had to know that this was an issue. They just haven't resolved how they're going to get that billing collection information on the site. So they're working on it and they know about it, but right now the situation is, the client calls, and/or I'm sure you with the client can call Co-Opportunity. They give you a number when you're getting enrolled and say call and set up the billing. So I'm sure it has something to do with their relationship with Health Partners. Some connection must not be finalized yet. So that's the firm that they've contracted all their billing and customer service, claims, administration, et cetera, to is Health Partners up in Minneapolis. So stay tuned for more on Co-Opportunity as well. All right, so the next page I'm talking about here now is the SHOP exchange. So then I hear somebody say to me, hey, I heard SHOP has been postponed for a year. Well, okay, let's clarify what that is. So you just don't use the healthcare.gov website in 2014. So to enroll somebody in the SHOP, literally, and I put a quote here because this literally came from CMS, and I'm going to read it so you guys hear it with me. Be sure to tell, and this is them talking to the end user client, right? Be sure to tell the agent, broker, or insurance company that you want a SHOP qualified health plan. So now, your employees must be enrolled in a SHOP plan for you to qualify for the tax credit. So here's the deal. As we know, it's the only company that's in the SHOP exchange in Iowa is Co-Opportunity. So we get quotes from Co-Opportunity, and then you'll look on their sheet, and there is their qualified SHOP plan. There is that plan that they need to be able to say, yes, I am signing up for the SHOP plan. And so we make sure that Co-Opportunity Health knows that. Notice it says that you don't need to apply for SHOP eligibility or wait to receive an official notice of eligibility before you enroll in SHOP coverage. So as long as we will let the employees, and actually they don't even, the employees don't know or don't care that they're enrolling in a SHOP plan, but it does say that you must get notification that you're eligible to participate in the SHOP marketplace prior to you filing your 2014 tax return. So we've got some time. So technically you're enrolling then in a plan with Co-Opportunity. Remember, the plans that Co-Opportunity offers on exchange must be offered outside the exchange. So anyway, the plans are the plans for Co-Opportunity. We're going to get enrolled. That is the only carrier you can enroll with for your client to be able to get their tax credit, okay? So I know that sounds a little confusing because they've really taken away the electronic enrollment in this quote-unquote shop exchange that's not ready yet. And quite honestly, we already knew that it wasn't going to have the robust capability that we'd hoped. That got pushed out to 2015, if you guys remember. So the future benefit to allow folks to utilize the healthcare.gov portal, and by then, I know Co-Opportunity will have their own portal that says click here to take advantage of the shop exchange. It'll go right through, you know, transparently into whatever they need to if it's at the shop to be able to get people enrolled and qualify in their shop qualified health plan. So it's just kind of crazy. So at some point it'll all be integrated, and once somebody logs on, if we've got more carriers, then they can pick which carriers your employees can once an employer is enrolled in the shop. But it's just a little crazy this year, so just go directly to Co-Opportunity if you know you've got somebody that's interested in the tax credit. And I do want to say something on the side, and that is that when you're dealing with small businesses, if you're already looking at a Co-Opportunity quote that looks reasonable, then you want to talk to them about getting the tax credit. If they go with Wellmark or any other carrier for their small business, they won't be eligible then to receive that tax credit. And because they have to be through a qualified plan, and Co-Opportunity is the only one in Iowa in the shop exchange in 2014. So, but I have talked with a few agents with their cases, and this is going to be really helpful for them, at least for 2 consecutive years. They can get this credit. So let me go to the next slide and just say, for those of you that want more information, this is a CMS website, and this came out because maybe some of you are getting the notifications as well from CMS. But just a reminder that CMS will be offering a presentation that goes into more detail about what I just said about the Small Business Health Options Program and the new enrollment process. And that's ours, the federally facilitated shop. That's us. So there's the webcast, and there's an FAQ that's posted on our KHI website, and I'll refer to that a little bit later in our conversation this morning, just to remind you where to go when you're on the KHI Agents website under our news. The FAQs went out, I think it was last week, and so there'll be more information there for you. Okay, so now let's talk about updates on HIP Iowa. So no rate increase for those clients of yours that are still sitting in HIP Iowa. Now, I'm not talking about the Fed plan, the HIP Iowa Fed. I'm talking about our old standby Iowa plan, which is HIP Iowa. Excuse me. With no rate increase in 2014, clients will still see some rate increase due to movement in age brackets. Notice also that they've received approval to stay around until the end of 2014. So once again, I don't want your HIP Iowa folks to panic, thinking that they're going to lose their coverage December 31st of this year. They won't. They'll be able to keep their policies until the end of next year, but many of those are paying a lot. And so to be able to get out and or may even be able to be qualified for a subsidy. So just know, though, that they've got time. If we can't get their application in, if you can't get with them and meet with them and get everything taken care of by the 23rd of December, they can get a February 1 or a March 1 effective date or April 1. Even May 1, right, depending on when you submit the application. And then open enrollment will be done, and they'll wait until next year. Remember, too, that they're exempt from the ACA guidelines that apply pre-existing waiting periods. So for those that might have gotten in on HIP Iowa this year that may still have some pre-existing waiting periods, those would still be applicable. Okay, so that's the HIP Iowa update. And we will be hosting, it's funny because I don't know if you guys, I think you realize this, but we got all the information about these new quoting tools, both you know, on all the websites, but in particular, Wellmark and Co-Opportunity. Those two in particular, the new Q system with Wellmark and, of course, Co-Opportunity's new quoting system. Both of those, we got the information at the same time you did. So we've all been learning to try to stay a step ahead of you guys to help you. So that's why we've said, you need quotes, you call us, we're going to help you because we're all learning. There was no opportunity for us to train you ahead of time to be able to generate your own quotes. which obviously would probably, and I guess I would think you would like to know that so that you can do a quote at 6 o'clock at night or 10 o'clock at night and not wait on us. So we're helping out as we can as we're all learning this, but we're learning some of the tips and the workarounds and the ways to do these things. So we're still going to help you guys, of course, definitely through the end of this month and I'm sure into January. But over time, we will want to train you and or your staff on how to do quotes because they really are quick and easy and you get them like instantaneously. So we're going to be hosting a webinar on Friday, December 20th. Now, I realize that's the Friday before we get into holiday week, but we didn't want to wait any longer, and I'm sure we're going to run this again, and we'll certainly be interested in your feedback on how often you'd want to see this or if certain times of days are better than others, but we hope that on a Friday morning might be a low appointment day for you and get this out of the way. So from 9 to 10 on Friday, December 20th, we'll be sending out the invitation very soon. If not today, I'm sure it'll go out early next week. We're going to be covering how to quote Wellmark Group, Wellmark Individual, Co-Opportunity Group, and Co-Opportunity Individual. And as I said, if you haven't done a lot of these quotes yet, we're learning some of the tricks. I even helped an agent do one yesterday, and it was interesting. I'm like, hey, we've emailed that proposal to the group. How do I get a copy of that proposal? Well, I guess I email it to myself, right? So that's like a little tip that we've learned, and we're like, okay, that's how you do it. I tried to add a second email address in there, and it wouldn't take it. So we're all kind of finding out, and as we learn more, we'll continue to share. So please mark your calendars if you can make it for that webinar from 9 to 10 on Friday, December 20th. Okay, here's some other important dates. And boy, let me tell you, I don't know about you, but remember, this will be posted on our website. So the audio will be posted, and I've also asked Nicole to just post the slides, so if somebody just wants to look through the slides themselves. But Wellmark individual applications for new ACA plans are due by December 23rd for January 1 effective dates. As you know, we are in open enrollment. They moved it out. Remember, it's normally the 15th of the month for a first of the month following, but because of all the trouble they've had on healthcare.gov, Wellmark also, even though they're not part of healthcare.gov, they agreed to align their deadline with the government, so with healthcare.gov rather. So December 23rd for January 1 effective dates for Wellmark individual apps. And remember, after that, which is so foreign to me, right now we're so used to writing odd effective dates, right? So if you need coverage tomorrow, I can write you today. Remember, we can do that for the non-ACA Wellmark plans all the way up until December 30th for a December 31st effective date for a non-ACA plan, and then that plan will be locked clear in until December 30th of the following year of 2014, right? It'll be locked in. Okay, those are all still being underwritten, but for January 1 ACA plans, December 23rd. After this, as we know, January 15th is the cutoff for February 1, February 15th for March 1, etc., right? So it goes all the way until we're still in for your March 31. If you get something in on March 31, that would go to a May 1st effective date, since you will have missed the April 1st, obviously. So that goes all the way out to May 1st. That's the last effective day during open enrollment. So I think you guys all got that, but I just want to be clear. So a little bit of an extension for this month. Wellmark small group renewals were due by December 6th for those ACA plans. So if you did have somebody that had a Wellmark plan and they were renewing 1/1 and they were going to move to an ACA plan, those had to be in by December 6th. Otherwise, Wellmark grandfathered plans, so those are folks that are grandfathered that have a 1/1, those are due today. If you have any questions on this or concerns, I think you guys have been working with our staff, so this should not be a surprise, but these dates are just boggling my mind anyway. So Co-Opportunity individual applications are also due by December 23rd, both on and off the marketplace for January 1 effective dates. Co-Opportunity small group employer applications are due December 17th for a January 1st effective date. Now what I'm learning now is if you're doing your quote, and I was just with an agent this week as we were talking through this, the employer says, yes, I want to do it. We have, because Co-Opportunity doesn't have one made up yet, we've created from their checklist, really an application. So if you don't have it, get it from one of our team members. But I actually gave that to my agent. The agent then sent it to the employer. Get that employer app in with all of their details by December 17th. Then the employee applications can come later. And I believe, and don't quote me on this, but I'm trying to remember, and I didn't write this down, but I believe Nakia said as long as we have the employee application submitted by December 26th, we're okay for January 1. But the critical point is you've got to get the employer app /checklist. And as I said, we've created an application out of the checklist because Coopportunity hasn't created one. So it's, remember, we're entering all this data online. So that's why they're not really creating applications, because we're going online. We must enter that employer information by December 17th for a January 1 effective date. Okay. All right. So those are some critical dates to remember. And now I want to also, I know I'm giving you a lot of dates and times, but hopefully, again, this will be on our website, or you've got time here, you're writing it down. We are going to host another KHI Wellness Solutions webinar on Thursday morning, December 19th, from 9 to 10 again. This is I'll say it's a repeat of the one we did a few weeks ago, but there were, I know, many people that weren't able to jump on that call that we did in November. So this is, once again, but I think you're going to learn, we're really drilling down, and we know now what you need to hear to be able to find out if you want to market this or not, and learn how you can then market this to your clients. So we're going to now learn the benefits to the employers who want to implement a wellness program. You're going to learn what tools are available to assist you in selling the wellness program, and this will be branded a KHI Wellness Solution. So we call it Complete Wellness Solutions. They're a wonderful firm out of Indianapolis, Indiana that we are partnering with. This is all they do is wellness. They don't have a health insurance brokerage firm on the side. They're not doing anything but wellness solutions. So they will host our call for us on Thursday, December 19th from 9 to 10. Again, if you can't make it, we will be hosting more of these. By the way, we'll be doing a very comprehensive with continuing ed credits on January 28th, 2014 in Fort Dodge. So not only maybe block the day on December 19th just for a webinar from your office, you'll dial in, but then block January 28th to consider coming to Fort Dodge for some continuing ed. If you're really serious and you know you've got a market that's going to really gobble this up, you've got maybe some good size cases, some group cases, and maybe even some larger cases, or how about those cases that you always wished you could go after, but you didn't really know how to open the door. We're so excited about this being able to be a door opener for you. And then the other thing, as you guys I think saw, I don't have this in my notes here, but Diane England has joined our team, and Diane's experience is in the larger group markets with not only partial self-funding but self-funded cases. And with her experience, and you use this door opener about wellness to a large case that maybe has 100 lives, 150 lives. You've always wanted to contact them, you know them, but you just haven't felt comfortable going in with health. Let's start with the wellness, and then we bring in the health and say, by the way, what are you doing? So anyway, I'm really excited because this is not only a door opener, but I think it's also a value add to take to all your existing cases so they don't get unseated by somebody else coming in and offering this and you haven't brought it to the table. So use it both to find new business, help you grow your business, but also take care of the clients that you have. You're going to continue to hear more and more about this. This is not going away, and I know it's been somewhat of a cliche and maybe somewhat of an overused term about wellness, but it's a good place to start to make sure that, and besides that, we know that there will be some kind of wellness tax credits, and it's just the right thing to do. We've got to figure out how to get all of us healthy, and what better role does an employer play than to touch all of their employees and care for their well-being and overall wellness. So anyway, obviously we really believe in it strongly at KHI, and we're thrilled about this partnership. So join us if you can, and if not, we'll be doing some additional training after that. By the way, this gal is coming into town to deliver it. The owner of this firm is coming into town on January 27th, 28th, 29th. So if you've got some cases that you'd like to showcase, she is interested in going out on client visits. So get to me first, because we'll take first come, first serve. If you've got some clients that you think would really benefit by having her come directly to you and your client, she will be open to doing that. that last week in January, those Monday, Tuesday, Wednesday of that week. All right? Okay, so get to me. Just shoot me an email from me or Sherry Dolacek, as you know. Now, Sherry's out today due to a funeral in her family, but Sherry is our point contact to help coordinate demos and anything else as it relates to wellness. So give Sherry or myself a holler, and we'll get you set up for a visit with Linda, who's the owner of this firm. Okay, so I also want to highlight, and if I need to do a little show and tell when we get to our Q&A, I certainly will. But I want to make sure that you know that at our KHI Agents website that we hope is a good tool for you guys. If you think of things that we don't have out there that we need, let us know. We know that we need to add the co-opportunity stuff. So I just had sent an email to staff reminding them we've got to get that stuff gathered together so we get co-opportunity added to our market segments by carrier. So you'll see co-opportunity added in both the under 65 as well as the small group or group tabs. But use those forms, the links, the things that we put out there, and again, we'll get co-opportunity updated very quickly. And then the news, when we push something out, and I don't expect you guys to be reading every email we send, but some days you'll say, oh, I know there was something that they sent, or I think I saw something, where can I go get that? Rather than trying to find it through your emails, just go to our agents, KHI Agents website and click on the agent portal, or click, excuse me, you're in the agent portal, click on the news, and you'll be able to sort it by date or category. And then last but not least, don't forget about our videos and our slides that we're doing to try to help you guys become those health reform experts in your communities. You're the go-to person for your clients and for new prospects. And I really think we're starting to see this sifting take place that I kind of predicted a year ago, which is this is where, you know, you'll either you get all in or you get out, right? And we're starting to really see that now because we know that through the certification on the healthcare.gov website to be able to get certified to sell on that portal through the marketplace. We know that that's taken its toll. A lot of people have chosen not to do that. We know a lot of people are not recertifying for Part D. It's kind of like this was like probably the straw that broke the camel's back, right? For a lot of people that really maybe never were fully committed to health insurance. When you fully commit to health insurance, you're going to see a lot of people uncommit, right, and get out of the business. So anyway, we've got training here to support you guys to make sure that you can do everything you can to be that health expert. And if you're not, make sure there's somebody in your office that is, because I really think that's what it's going to take from here going forward. All right, and like I said, we'll review that if we need to actually go to the site and do some show and tell later. So this leads me to an announcement that some of you knew is coming, and I have to apologize that we have to go here. But I think most of you have said, we understand. Today, you go to khiagents.com and you click around and you get whatever you need. But we have talked not only with our Agent Advisory Council, who hands down said, yes, KHI, you need to lock down your website. Only those folks that are appointed agents with KHI should be able to get onto khiagents.com. So we didn't want to have this happen, though, during this crazy time where we were in this not only open enrollment for the under 65 stuff and small group stuff, but all the stuff going on with Medicare, the annual election period. So we decided to wait, and we believe it'll slow down greatly right over the holidays. So either it's going to be, we're going to try to lock it down between Christmas and New Year's, or right after New Year's, or on New Year's Day. Somehow I've got my person that helps me with our website. We'll be doing all this sometime over the holidays. We will send a communication to you to give you some directions and give you some dates. Our site will never be down, but you'll all of a sudden notice one day when you go to click on KHI Agents and it prompts you to log in to access certain information, you're going to know that, okay, the site is live. I mean, the lockdown is live, rather. So we will give you the directions on what and how you'll log in. When you have problems, obviously you're going to call our office. So we'll try to do this on a business day. We're not going to do it on a weekend where you might try to access something. We'll do it on a business day so that when you try to log in, you'll have our staff to be able to call to and say, sorry, I didn't get the email. How do I log in? But hopefully, again, we'll send out the email to you guys so you'll know how to log in. And what we presume to use right now, and this is preliminary, but we're thinking that we will use your email address as your log on, because that's simple and we have it, so we can set everybody up. Your password, though, we'll set you up with a temporary password and then you'll need to change it. So we will not dictate. Initially, some of you we talked to about this, but that just wasn't going to work. We need you to have the ability to own your own password rather, and we'll have the technology built into our website where you can generate a new password for yourself. It's so important that we secure this. We will be moving to a secure portal, which just means we pay something extra to have extra security, because in the future we could see posting the commission statements out there on our secure website. So that's why your password and you knowing it and only you knowing it is so critical. So we won't know it, nobody else will know it, there won't be some formula to figure out what it is. It'll literally be your email address will be your logon, and I'll even find out from the company if you can change your user ID. We were going to do that initially up front so that we know what it is so that we can help you get in. But if we go to put your commission statement out there, obviously that's PHI, that's all kinds of information out there. We need to make sure we have incredible security, which also could mean implementing security questions to make sure that you are who you say you are, and so no one else is accessing that important data. So just know that that's coming, and again, for some of you that are painting over this because it's one more login and password to remember, I hope you appreciate the fact that what we're trying to do at KHI in terms of our value proposition to you, I really want this only for you. If somebody doesn't contract with us, then they shouldn't get access to our tools. Okay? Excuse me. All right, so that's the end of the presentation that I had put together. It's a 9:32, which gives us plenty of time for questions. And by the way, if I don't remember to tell you, Merry Christmas and Happy New Year. I'm always interested in your comments, in what else we can do at KHI to support you. We will continue to support our staff who support you to make sure that they have the information they need so that you don't get the runaround, so that you don't have to wait days and days and days for an answer, that we do our best to try to turn everything around in as quick a time as possible. So I'm going to go to our KHI website as a backdrop, and hopefully you can see that. I'm just going to KHI agents real quick in case I need to refer there. And then I'm going to open up. I can't really open up the phone lines because we've got quite a few of you on the line, but I'm going to go ahead and look for chats or look for questions and look for hands raised. So you can do that any way that works for you. I think if you're on your computer that does not have a microphone, you need to do a raise hand. So let me check and see if we've got any hands raised. And otherwise you can ask a question or do the chat. I'm just going to scroll down through here and see if I have any hands. Okay. Checking as well for any questions. Questions or comments? And looks like we've got a little issue here with our khiagents.com. Well, that's not good. There we go. Okay. Sorry, a little glitch there. Okay, going to look for any more messages or hands raised. Any comments as well? Go ahead and just take a moment. I know if you want to type something in the chat box or type a question. Okay. Looking for anybody that, let me just check and see. Got any hands? Here we go. Excellent. Let me see if I can get Craig. Hopefully I can get you on the line there, Craig. And if you've got your mute button, go ahead and unmute your phone, Craig. I think some of you, we've learned that you need to, if you don't have a microphone on your computer and you're dialing in through the web, that you need to use a cell phone or an office phone to dial in separately on the audio portion of the call. And so, Craig, I've unmuted you, but I wonder if you might not have a microphone there. So you might be able to email a question even to one of the staff and have them run it in to me if that works, if you can't get to a chat. Let me go ahead and see. There, I've got Patty Bradley.
Yep. So,
good morning.
Good morning. So basically, to help the clients, the best thing to do is to just call in and you know, if we know that they qualify, they need an ACA plan, and the best thing to do is to call in to get a quote to get help with that.
Well, if they want an ACA plan, I'll just kind of, yeah, the first thing I do is assuming you have your appointments with Wellmark and Co-Opportunity. Those are the two, because I would quote and or Coventry, but I'll kind of highlight Wellmark and Co-Opportunity. If I'm appointed with Wellmark, I go directly to the Wellmark system, and I go to their Q, the new tool they have for quoting. You can get your own quotes that way. If you've not done one before and you're struggling, that's really, a lot of you guys are in that position. You can call us, and we'll kind of walk you through. It's kind of best that you're on your computer when you call, because then you might need to make some modifications, add the dependent, take off a dependent. And so if we can show you how to go and get there and do a quote, we'd like to walk you through that process. If it's a Co-Opportunity, you can go to Co-Opportunity's website. We like that you log in as an agent or a broker with Co-Opportunity. If you don't have a login yet to Co-Opportunity, at least want to shop their rate, you can certainly do that on their self-service tool that's right on their website, coopportunityhealth.com. Don't place the case there. It becomes a house case, but you can at least shop and get a rate and see if they qualify for a subsidy. So all that you can kind of do on your own, but if you have questions or you're not sure, get a hold of us. The quotes are kind of cool because you email the quote to the client. If you're talking to them over the phone, you can email them the quote. You can email it to yourself. That's what we're finding out, right? You can do all those things. Yeah, try to help them through the process. And a lot of this then can be done online, e-signatures and things like that. So yes, call if you have questions. If you've not done one yet, you've got until December 23rd to get those applications in for January 1 effective dates for those folks that want to move to a new ACA plan. That's correct.
Okay, so basically it's kind of like when you look at the situation and you kind of know that they would qualify for a subsidy, and you know, knowing that, you know, they need an ACA plan because of pre-existing conditions, you know you're moving probably towards a Co-Opportunity, or is it sometimes you find that it could be a Wellmark plan possibly, or, you know, well, I have Coventry too, so I don't, you know, Coventry I'm confused about what to do with their, you know, being on the marketplace. You know, I don't, how do you go about a Coventry quote to compare?
Yeah, well, actually, if you know they qualify for a subsidy, sometimes it's fun just to, if you don't know if they qualify for a subsidy or not, you get a Wellmark quote. You can still get a Co-Opportunity or a Coventry quote. Co-Opportunity does have their website that they use as well. We've got that on our KHI agents, or you can call us. Again, we'll help you through this first time because it is confusing. Coventry did change their quoting website. So anyway, so if you know they qualify for a subsidy, though, and that way you guys use that little cheat sheet we sent out to you guys. If you don't have it, it's on our website. If you still can't find it, we'll send it to you. But it's the sheet that gives you the federal poverty levels. And if you know they're under 138% of federal poverty, that's iCares. If you know, and above 100%, then you know, because otherwise, if they're at or below 100, send them to DHS. But if they are up to even 400% of federal poverty, then you want to go ahead and go right. I would take them right directly to healthcare.gov. We're seeing some success now. I know we've had some folks, some agents call and let us know they've gotten folks enrolled. And when you get on healthcare.gov, based on the zip code you put in for the client, you're going to see Co-Opportunity and Coventry. Those are the only two plans. So then you can just move right through the enrollment process. Just they have to put in how much their household income is, et cetera, and then pick a plan and enroll. So you can actually get your quote right on healthcare.gov.
Okay.
All right. Thanks, Patty.
All right, thanks.
Yep, I think I've got another question here. Let me scroll down a second. Okay, and I guess I don't see any other hands raised. I'm looking for any chats, any other questions. Okay, I'm trying to see if I've got anybody else that's raised a hand. And here I've got Doug. See if I can get you. I've just unmuted you, Doug. Peyton?
All right, can you hear me?
I gotcha.
If you are doing an analysis of their income and they've had a drastic income change, do you use last year's income or do you use the expected 2014 income? How do you know what income level to use for qualification?
Yeah, what the recommendation is, and if you think about this, you really want to use their anticipated income for 2014, because and we've talked to a lot of people, because actually if they anticipate income at a certain level in 2014, that'll be more accurate than what they maybe made in the past, because their circumstances have changed, whether it's job changes or taking Social Security or whatever. And so you really want to go with what their anticipated income is for 2014. And when you submit that anticipated income, what comes back on healthcare.gov is the appropriate subsidy for their age, for their, I guess it'd be for their age and for their income level and for the household, right? How many people are on the policy? All those things make a difference. So that's why when you go through healthcare.gov, use that estimation, because here's the deal. It'll true up at the end of the year when they go to do their taxes in 2015, looking back for their actual income in 2014, and that's where it all trues up. So I've kind of been telling agents to tell their clients, I would overestimate slightly. You don't have to, not dramatically, or you're going to lose the benefit of the subsidy perhaps, but I would not estimate low, or you would end up perhaps paying more in taxes, because that's where it's going to get trued up. Did that answer your question, Doug?
It answered my question. I guess I'm still a little confused as to what is going to happen with the Affordable Care Act. Is there going to be anything that you see coming about that may be a non-qualified health plan, maybe more like an AFLAC, that is going to be used to help pay those high deductibles?
Well, I mean, I think that's always been a part, right? I think a lot of people, especially as a lot of people are moving into qualified high deductible health plans, I think that that's been something a technique a lot of people have used to try to plug some of those gaps with either hospital indemnity insurance or accident insurance or some of the critical illness insurance. So I think that's still in play, but I guess, anything can happen, right? So if you listen to too much of the news, you know that anything could happen to this thing. And so sometimes what we have to do is just say, I have to operate with what I know today. And what we know today is the government will fund these plans. The client, the member, if you will only pay their percentage, what's been given to them by the government. That's why we use estimators of their subsidies on maybe Kaiser Family Foundation. We've shared that link with you guys, or on Co-Opportunity's site. But until you get your subsidy by the government, that's what you want to go with. And so we believe that will happen, that the client will only pay their share, and they will have a health plan come January 1. So, and it will all get trued up at the end of the year when they do their taxes to find out, hey, you made more than you thought, so you shouldn't have gotten as much subsidy. So they'll take a little back off of their tax return. If they don't get a return, then they're going to owe a little back in taxes.
One of the things we hear about is identity theft, and if you go on to healthcare.gov, you're just setting yourself up for somebody stealing your identity. Maybe you could respond to that. Maybe I listen to too much news.
Yeah, no, I listen to what you do too, Doug, and all I can say is with reservation, if people, I mean, I don't sell this to, when I'm visiting with an agent with their client there, I don't tell that you have to go get your subsidy or anything. I mean, I just let them know you can. And yes, there might be. I mean, anytime you use a website, there's a risk that somebody hacks it. What we're hearing in the news is, obviously, we're hearing all of the issues, right, including because they're just being grilled. So we're learning all of the really, which other companies, if they had issues, they would try to keep those under wraps, right? But you still hear about in the news that a certain database got hacked. And you still hear that from other companies, but I'm not trying to make light of this because it's really, really important. Think of it, not only our Social Security information, but all of our financial information. And I say all, it's going to be our household information. So tie that with other dependents in my household, and yeah, we're at risk. So I think because it's been brought to light, I know they're working on it. We know that. But yeah, if somebody's got reservations, I would just tell them then I wouldn't purchase on the healthcare.gov. There are plans Wellmark has, and Coopportunity and Coventry all have off marketplace. So if they're really concerned about that, I wouldn't put them in one, you know. So.
Do you have a list of the companies that you represent anywhere on your website, or is that something you can send out to us?
Well, yeah, if you go to, in fact, I'm on the portal right here, and if you go to, and this is what we're going to be locking down. So and we obviously, we have our Join KHI tab, so that'll be open to anybody that might be interested in getting contracted with KHI. But if you go to our agent portal under our forms and links, and this is where I just said earlier in the call, we've got to get our Coopportunity information added because we've got, of course, how to get licensed, but our individual solutions, you'll see, here's our under 65 carriers, and like I said, we've got to get Coopportunity on there, so there's Assurant and Blue Cross of Nebraska, Coventry One, Golden Rule, Wellmark. And then if you go under our Medicare solutions, you'll be able to see the different carriers, so there's AARP, Aetna, Gerber, Mutual of Omaha, and Wellmark, and then our PDP plans, and then our Medicare Advantage plans. So I think all but Coopportunity is on there right now in terms of the carriers that we have. So that's probably the easiest way to go, and then you'll just see the information right there. Because when we add a carrier, it's a big deal, and we're just now saying, oh my goodness, we've got to get Coopportunity stuff out there. But I think we held off to find out what do we want to put out there. We don't put everything out there, but we try to provide a place for you guys to go so you don't have to go to all these different websites. So when you go to Wellmark, for example, on their Medicare supplement policy, so here's the website to get there, and then we post some of the most commonly used forms. So there's your Wellmark outline of coverage, the updated application, and we find this to be a benefit to our agents when you guys have so many other things you do, to be able to just come to KHI agents and get any carrier's information, rates, applications, like I said, the most commonly used forms for all of our carriers, for all of our market segments. Did that answer the question, Doug?
Well, I don't have a question, but I do have a comment. And as you know, I'm a Wellmark transplant, and I would say that you have probably been one of the agencies or the field marketing organizations that has been most responsive to the educational thing that I've come across so far. So I just wanted to thank you for the heads up sort of thing that you're providing us.
Oh, you're welcome, Doug. Well, thank you. Thanks for that feedback. Okay, I'm going to go on to the next one. I see I've got another hand raised here. Tom Riley, I think I've unmuted you if you can hear me.
Yeah, hi, Lynn. Hey, thanks for all of this.
Morning.
This is very helpful. Also, by the way, thanks for the referral. Hey, I got, my question is, if we keep getting bogged down on this website, they say they say you can go paper forms. I mean, can we just print off a paper application and fax it through, or do you not recommend doing that? Anything just to kind of speed this process up.
Oh, I hear you, Tom.
I mean, I know they would qualify for a tax credit.
Yeah, and here's what's been so crazy, because in our world of what we do before all this came along, when we would do an application, that was signing up for business, right? And so the government uses the application word and the enrollment word. So the paper applications are merely to find out, do I qualify? It kind of, I shouldn't say merely, but it collects all the pertinent data on the client, right? And then it finds out, do you qualify for a subsidy and how much? So when they say you can fill out a paper application and send it into the government, what you'll get back is, based on the information submitted, what your subsidy is going to be, which is nice to know, but you still can't enroll except for through healthcare.gov online. So
Okay.
it's so misleading.
Okay. So there's just no way, you just have to plow through this, and hopefully this site will improve.
Yeah, yep. And I don't know, I know some agents have had more success doing things, off hours than during regular business hours. And, maybe if we've got some agents that have raised a hand, I've got some more hands here, and this is great conversation. So if an agent has gotten one through, maybe they can jump on and share with us. But yeah, for right now, it's going to, and I did sit with an agent, with a client, and we got all the way through to pick the plan. So we set up their account, got all their data entered, and got all the way through to now pick a plan. And honestly, by that time, it was like we were late and they needed to leave, and they wanted to think about what plan they wanted. So we should be able to go back to their account. I'll help them log in, because remember, we're not supposed to set these up for them, right? I'm like, are you kidding me? Anyway, so yes, I'm helping them, and they get their account set up. Then with their agent's help, not me, but with their agent, then they can continue their process. So so far we're having a little bit of success. So give it another go.
Thank you. I appreciate it.
All right, you bet. You bet. Thanks, Tom. Okay, and see if I can get to the next caller here. And I see a hand raised, and I've got Carla Beckendorf. Hi, Carla. Whoops. Did I lose you, Carla? I've got your mic opened. Okay, I'm going to go ahead and go to the next one. And here's, see if I've got, whoop, there you go. I think I have you, Carla. Carla? Okay, I thought I had her there for a second. All right, let me see if I can go to the next one. Okay, let me just check and see also if I've got any chats or any questions. Okay, I'm not really seeing anything else. Let me just see. And if Carla, you had a question, let's try it again. And Tanya, I see your hand raised, Tanya, and I'm trying to unmute the handset here on my panel, and it won't let me unmute you for some reason.
Lynn, can you hear me?
There, I got you. Hi.
Hi, this is Tanya, and I wanted to comment to Tom about the paper applications.
Thank you.
And sending them into the address listed on the application. You can fill out a short form, but I have some clients who filled them out in October, and they're still waiting for their information to come back. So when I called about them, the website or the healthcare.gov told me it can take anywhere from 30 to 45 days to get an answer back. And that's only giving them the answer on how much subsidy they're going to be eligible for. So what I've done is I've gone through and sat with my client and walked them through the whole process. And it takes about an hour to go from, them setting up their account to explaining what the policies is, and you just do it online. Now, I did talk to somebody the other day, another client, that she shared with me that she just called healthcare.gov and went through the whole process. They took her payment online. It took her 45 minutes. So I'm seeing some success, but not with the paper apps at all, because it's just taking too much time. And if you have somebody that needs additional information, like one of my clients had to prove their citizenship, that's taken anywhere from 7 to 14 days to get an answer back to find out what they're eligible for subsidy. So I just wanted to share that with you, Lynn.
Oh, no, I appreciate that, Tanya. Thank you. This is this good stuff, because sometimes you guys are out there having some good experiences. Okay, great. Thanks, Tanya.
Yep.
Okay, and I thought, Kenneth, I thought you had your hand raised once. Ken, did you have? I'm going to try to unmute you here. Did you have anything, Ken? Let me see if I can get to you. Okay, I'm not seeing anybody else here, I guess. Okay, any other, give it last here, it's just not quite 10 o'clock yet, but just give you any other time. Ken, I've got your microphone unmuted. I don't know if you had a question or wanted to make a comment. If you have a phone and you can unmute. Okay. All right. Well, as always, send me an email if you have anything that we can do to help. And this has just been, I'm proud of all of you guys for just sticking with it and working with us to try to help your clients, because I think in the end, you know, it's still all about serving them, and you know there's folks out there that need us. In fact, I'll share this with you real quick. So I'm at this presentation yesterday. I was asked to speak in Grinnell to the Employers Council of Iowa. It serves 4 counties, and so I went and did that with another agent and with one of our KHI agents, and it was really interesting because we were there with a gentleman from the Iowa Insurance Division, and he is a contracted worker through a federal grant, I'm sure, that Iowa obtained to go out and talk to groups about the Affordable Care Act. And part of me is just scratching my head, and I'm thinking, you know what? We are out here doing this. This is what I've committed to over the last 8 to 12 months. Us on behalf of KHI, both Brenda and I have been out doing seminars to try to educate the community, and also, as you know, do them with you guys so that you're showcased as the expert in your community. And you got, if you're still hearing or seeing of need, please let me know, because I will still come to your communities. There are still people that don't know what's going on. The individual market might be a little bit late, but still, with the group market, there were probably 36, I think there were 35 or 36 employer groups represented at this meeting I was at yesterday. They still don't know what's going on, and we've invited them that if they're happy with their agent and they're getting what they need, then God bless them. But if they aren't getting what they need from their current agent of record, they need to get with one of us who are certified to help them. So there are still people out there looking for help. It's not too late to do a seminar. So let me know, and especially as we continue to see this thing evolve into 2014, small groups are still wondering what to do. And we can't get everybody in, as you know, by January 1. So be thinking about, once we get the ones that we have to get in, the 12 ones are done, now we're working on the 1 ones, or those that are, you know, going to be moving. We'll start working on any of ours that haven't renewed, you know, that didn't, what do I want to say, that didn't take that early renewal option. Some didn't. I just talked to an agent at a case that renews in March, and they're going to have to renew. In fact, they're shopping now and probably going to move to an ACA plan January 1. So there's still going to be a lot of activity, but still time for securing relationships with new cases. And if you're interested in growing your business, that's why make sure you get a hold of me or Diane England, because Diane will come out. And this was, I was telling you about Diane earlier. She'll come out and visit with you and talk to you about how we can help you grow. So we're just so excited about Diane as a resource to come out and help you and support you, and especially when you don't have that really extensive group background, she'll be there to help you. And we really believe that there are people out there looking, and I'm telling you, we picked up people that came to us right after the seminar and said, I need help. My existing broker is not helping me. So you guys, let me help you. Let me help you do seminars, and then partner with Diane and the rest of our team that's back behind the scenes. And again, I just want to do a shout out to the rest of the team, Nakia and Tricia and Erica, and we've got Tricia also that joined our team, Tricia M, and Katie. So there's our agent support team there just to help you guys do anything we can to make sure that you are serving your clients, okay, and taking care of your folks. So with that, I'm going to do one final little look-see to hear if there's any other hands raised. And I see Joni. I'm going to go ahead and open up your mic, Joni.
Hi, Lynn. I just wanted to tell you that, did anybody read the paper yesterday? There's an article in there, and on the front page of the Metro it says 25,000 apply to insurance site. But then you get into it and you turn on the back page and it says, the new report says that Iowans completed 12,755 applications. So now we went from 25,000 to 12,755 because those were multiple family members. Then you go a paragraph further and it says, of those, the system gave determinations that 7,382 would be eligible for public programs like Medicaid or Hawkeye. So now we're down to, and another 12,613 were determined to be eligible to enroll in private marketplace plans. And that would be probably people that were off the exchange, right? And then it says including 4,946 whose incomes are low enough to qualify them for public subsidies. So there, that would be the ones on the exchange, right? 5,000, but they're not completed. Those are just people that went in and got a user ID. And then it comes down, the last thing, it says just 757 Iowans managed to select and sign up for private insurance plans being sold on the website. So we went from 25,000 to actually 757 actually signed up on the website.
Thank you, Joni, for doing that math for all of us this morning. Yes, I did see that article, and you're right. You've always, that's the headline, and then you got to drill down and read it. And you and I, we all know that the people are not getting enrolled. We've just not had the luck. And you keep hearing too on the news about we're running out of time. And I'll be surprised if they don't extend open enrollment. They probably won't announce that right now. They want to try to get everybody in, but I'll be shocked if they don't extend open enrollment this year. But we'll see. We'll see. Thank you for sharing that, Joni. Was there anything else? Okay. All righty. Well, it looks like I don't see one more quick look here, any other hands, and it is just a little after 10. So again, I just want to thank you guys for your business. Thank you for your support of KHI, and hopefully if there's anything more we can do for you, you just don't hesitate to let us know. Merry Christmas, Happy New Year, have wonderful times with your family and friends, and we'll look forward to serving you hopefully even better in 2014. Take care, everybody. Have a great day and a great weekend. Bye-bye.